Hi and welcome back. My name is Roxanne Pacheco. I'm a licensed clinical therapist and I am certified in trauma and preventive medicine as well. Thank you for returning for one more day of learning about mental health. The topic for today is the connection of mind and body. Believe it or not, our brain is the most complex of our organs, and because it is considered the first brain, we have a tendency to avoid many of the things that are affecting us, our emotions primarily, and those emotions get transferred over to what is considered our second brain or our gut. From that point forward, if you pay close attention, many times you'll be able to identify that there's either any problems as far as GERD, reflux, gastritis, diverticulitis, you name it. Any gastrointestinal issue will usually take place when there has been an emotion that has not been worked with or through. From that point forward, once our system, our gastrointestinal system begins to get affected, then what we get to see is that a lot of chronic illnesses will usually take place. Amongst these are, for example, diabetes. Diabetes is one of those illnesses that heavily becomes dysregulated when there's an emotional dysregulation. As a matter of fact, I have a lot of patients that come in and they get frustrated because they're saying, I'm taking my medication, I'm doing everything the doctor's telling me to do, I'm recording my glucose levels, and my sugar levels are still out of control. The reason for this is because a dysregulation in our emotions will cause a dysregulation in our glucose levels as well. Now, on top of this, you may notice muscle tension, fibromyalgia, which is that label that many times is given because doctors really don't know what else to do. They've tested you, they've put you through numerous lab works, numerous outside specialists, and they come back with an inconclusive finding that, as a matter of fact, physically there is nothing wrong. And once again, that creates a lot of frustration in many of my clients because they say, how can you be telling me that nothing is wrong? How can you be telling me this when I am feeling this way? When I'm touched, when I touch myself, there's so much hypersensitivity and there's pain. How can the doctor be telling me something's not wrong with me? How can he be telling me I'm quote unquote crazy? It's all in my head. So to put a rest to this, the information that I want for you to make connection with is that the brain and the body go hand in hand. As Dr. Bessel van der Kolk says, the body keeps the score. Traumatic experiences will cause physical manifestations of illness, and these go hand in hand. So I want for you to just reflect as far as what's going on with your body. What are some of these signs, some of the indicators that perhaps you're receiving these alarms and you're not paying attention, because the natural thing to do is simply to avoid and not face whatever it is that we need to work through. So that is the task for you today. Go ahead and reflect, scan your body, pay attention to what signs and what indicators your body has been giving to you that perhaps tell you, similarly to our vehicle, a light turns on and we tend to get to a place or a position where we simply ignore it. We're driving around with a check engine sign on, and we learn to ignore it until the vehicle breaks down, and there's really no way to ignore it. There has to be some sort of intervention. I would like for you to learn to identify what some of those triggers are in your body, what some of those warning signs are, so that your body doesn't go into a breakdown, which many individuals call a mental or a nervous breakdown. Let's avoid that from happening, because as a matter of fact, you don't have to place your mind and your body through something so strenuous. So if this makes any sense to you, go ahead and give it a thumbs up, like it, subscribe to my channel, and let me know in the comments what works for you, what doesn't work for you, and what topics would you like for me to talk about or address in future videos. As always, I say to you, trauma is real, but so is healing. See you next week.